Good morning, everybody. Larry Wolk from CDPHE. I want to thank Kirby and Mesa State and everybody involved for having me back. I think this is my third or fourth time here, and sometimes the reception's warmer than others, so I think this is a pretty good year to be here. I also want to do a shout out to our local public health partners. I don't know if Wavon's here. She's almost always here. But anybody else here from Garfield County Public or Environmental Health? Thank you for coming. Any questions, please ask him. We always defer to our local public health partners wherever possible. And then also, I like to be respectful of people who observe different holidays and observances. So for those who are observing or celebrating, happy 420. Matt, especially. Oh, sorry. I know. I appreciate the opportunity to get out of Denver today and be here, so thank you. I thought Kirby asked for a department update, so I like to give kind of the whole department because many of the things, if not all of the things that we do at the health department seem to affect all of us. So I'll start with the public health side because we're obviously have this moniker of being the leanest state, and that continues. We continue to be amongst the leanest states when it comes to obesity across the country. You're laughing because you had the pork chops for breakfast? But no, it's the other white meat, so I had them too. It was good. But no, you know, it's actually a good thing, and I say that because I like to highlight that, you know, health departments, we're involved in doing ongoing surveillance. We don't have to do special studies. We don't have to be called in to examine or evaluate particular parts of the state or particular industries because it's core to our responsibility to make sure that we're doing surveillance and education as part of our mission. And so we continue to be a state that's not just the leanest, but we have amongst the lowest cardiovascular risk of any state's populations in the country, which is heart attacks and strokes, and even most types of cancers. And so it's something I like to sort of set the ground for everybody to make sure that we're all on the same page. We do have some challenges, though, and one is immunizations. We continue to see that immunization rates are falling off, and you know, it's one of the great public health interventions of this century with regard to preventing, and the science is very strong when it comes to demonstrating the value of immunizations. And so we don't want to interfere with somebody's right to exempt from immunizations, but we certainly don't want to misinform the public about the value of immunizations. A little less controversial and where we get bipartisan support when it comes to concern is around opiates, whether it's prescription opiates like Vicodin or painkillers, or whether it's illicit opiates like heroin. Our state is not exempt from this problem, and we see this problem statewide, especially in rural areas of the state where resources are limited when it comes to trying to provide not just prevention, but treatment services. So high priority for us as a department. We're working with the Attorney General's office. We're working with legislators from both sides of the aisle. The governor has always had this as a priority, and now the lieutenant governor as well. So a lot of work, and even the Trump administration just released $500 million to come out to the states nationally to help address this issue. The other opportunity is mental health, yes, related to some of the opiate issue. And so we continue to work on trying to get our doctors' offices, our clinics integrated so that we have a one-stop shop when patients come in, so that we don't stigmatize and kind of silo mental health services, but make mental health services core to the type of health care that people can expect. So we continue to expand something called SIM, which is our state innovation model to integrate mental health services as part of the overall healthcare system. And then as an extension or an unfortunate end measure of our mental health issue is our suicide rate. Our suicide rates, especially amongst teenagers and middle-aged men, continues to be amongst the highest in the state. And so obviously what we're doing and what we've been trying to do hasn't really been working to address this issue. And we look at all kinds of things, whether it's genetics, whether it's acquired, whether it's the economy, you know, whatever the case may be. And so I point out because in this particular part of the state, we're piloting a program with gun shop owners and gun range owners, where we use this as an opportunity to try and provide some education for folks who are either purchasing guns or using guns in gun ranges, because guns are implicated in suicide 8 times more than they're implicated in an act of violence. So this is not a political message about gun control. This is about taking advantage of an opportunity, because the data shows that guns and suicide are associated, and so we have to do a better job of making sure that when folks own a gun, we're educating them and providing them the necessary resource so they don't use it against themselves. Speaking and coming back to 420, I'll talk just a bit about marijuana. There's a lot of talk about whether legalization has been a good thing or not, and other states, as they adopt legalization, and now the country of Canada, always look to Colorado to see what our experience has been. And I'll say that in the short term, our experience is that we still haven't seen an increase in marijuana use amongst our youth, and we don't see an increase in marijuana use amongst adults. Now, we started with what I would consider relatively high use, no pun intended, because 1 in 4 adults were using marijuana prior to legalization, and 1 in 5 teenagers were using marijuana prior to legalization. And so we still see that same rate. It's an unacceptable rate when it comes to teenagers, and so we're continuing to see what we can do not to just maintain status quo, but how do we lower that rate and make sure that we're not putting our kids at risk. From a public health standpoint, we initially saw a spike in emergency room use, room rates, as well as hospitalizations. But then as we dug a little deeper, we saw that that was being driven by and large by out-of-staters who were not familiar with our products or how to use those products. And so we've made some efforts to try and not just educate our Coloradans, but also our tourists who may be partaking. And to answer that question for anybody who's thinking, we haven't seen a significant bump in tourism as a result of legalization. We just see more tourists taking advantage of other legal opportunities when they're coming here to ski or to hike or to hunt or to do whatever. And then the last thing I'll say in marijuana, just from an educational standpoint, is we don't really know yet how to interpret driving under the influence, because you'll look at a number of different folks who will come out and say there's a higher rate of DUIs, there's a lower rate of DUIs, there's more fatalities. And the issue is that we don't necessarily have the same kind of testing like we do for alcohol. There's not the sophisticated roadside testing, nor is there sort of this correlation between what's in the bloodstream and being impaired. So for example, somebody could have had marijuana. I won't say I, because then they'll clip the video, and next thing you know, I'll be on video saying I. Somebody could have had marijuana a month ago, and they could still have a detectable level in their bloodstream, and that doesn't necessarily mean that they're impaired. So impairment and level in bloodstream is something I like to make sure people understand, because we don't yet have a good answer on how we can truly measure impairment and the use of marijuana and driving. And then coming down into oil and gas as I transition to the environmental side of the House, the task force that was created a few years ago was very beneficial, I think, for the folks of Colorado as well as for our department, because we've been able to do a number of things as a result of getting some funding there. One is we host this resource line and resource site so that folks who have concerns about health or really anything else as it relates to oil and gas are calling in, and we're either directing them to the appropriate resource or we're gathering the information and we're seeing what folks are concerned about out there. And so Mike Van Dyke's going to talk to you here at 11:30 or so and tell you a little bit about our study, and going to probably talk about our resource stuff too. If you weren't, you are now, and give you some stats as it relates to that. But we also now have a mobile monitoring unit that's live, and so if we get enough calls or if we get concerned that we're hearing from a particular community about health concerns, then we send our mobile monitoring unit out, and we'll spend anywhere from a couple of days to even weeks doing some investigation and some monitoring. And we were out, I think, in Erie a couple of weeks ago, and so a couple of other places that we're looking to get the monitoring site out to, and again, Mike can give you more information about that. The task force also charged us with putting together this compendium, which was released a couple of weeks ago, looking at the health effects specific to oil and gas operations, and I won't steal Mike's thunder, but again, stand by the report. And I think, again, just like we did for marijuana, it's important for us as a health department and as scientists to make sure that we're putting forth the evidence basis, and at least the evidence basis that we know of today. So let me transition to the environmental side. I'll start off by saying, first of all, that for those who don't know, of about our $500 million annual budget at the Department of Public Health and Environment, 2/3 of our funding comes from the federal government. So we are not heavily funded through state general fund, because our second largest funding source is cash funding through permits and programs and licensing fees. So we, like my colleagues at Department of Natural Revenue, get concerned when we see budget cuts because that just doesn't occur at the federal level. That trickles down to the state, and we send a lot of that money through to the local entities, and so that means the potential to cut state and local programs. The governor received a letter from the relatively new director of the EPA, Director Pruitt, who had a statement that I thought was pretty telling, that this is the end of coercive federalism. And so I'm not sure, I think you can cut both ways with that knife. And so what we're hearing, and I'll share what we hear, which is that the approach seems to be one of, if it's important to the state, the EPA will not necessarily get in the way. They'll come and take sort of the second chair to the state, but that the EPA does not necessarily want to lead on issues, and as such, they would like the states to take on more of the authority, more of the work, for a lot less of the money. And so we're just studying this, and we're just analyzing this and evaluating the president's budget for this year as it continues to be examined, as well as for October of 2017 for the next year. So no changes as of yet, but of course we're looking at what the tea leaves are telling us with regard to what may be cut, grants to the states, and again, those grants that we use to then provide to the local communities, whether it's related to monitoring or infrastructure, are certainly at risk. For anybody who's concerned about radon, a complete zeroing out of the federal assistance for radon programs. Environmental lead surveillance is another one that was zeroed out. So again, a long way to go before anything gets approved, but these are the things that we've seen. They're public documents, and we're continuing to follow. So I'll wrap up just just by saying, you know, on the environmental side, you know, I think of things as land, water, and air. And on the land side, you may hear that we continue to work through issues with landfills in many of the smaller communities around the state. We're trying to, this is a multi-year program where we've studied with the legislature the past couple of years that many landfills are not in compliance. And so we have to work to either help the communities get these landfills closed or get them into compliance. And so there's some money to help, not a lot of money, but there's some money to help, and there's all kinds of options for all kinds of price ranges. But some of these decisions are painful for some communities, and so you may hear about that as we continue to try and work with each of them on making a decision. On the water side, I think it's relatively quiet relative to air, so I won't say anything other than I don't see any significant changes coming, other than we're looking at doing hearings as it relates to establishing new levels of molybdenum, the otherwise known as moly, and so working with Climax as a stakeholder on this to make sure that we come up with appropriate moly levels for discharge purposes. And then on the air side, you know, there's a few things we have to, at least at this point, continue to work toward complying with federal rule as it relates to adaptive technologies. And so we are working with industry as a stakeholder to make sure that we come up with a rule for the state that makes sense. You know, I think we're good right now on methane and waiting to see what happens at the federal level, again, as a result of the EPA. Carbon, you know, I think there's probably similar to methane. I think economics may sort of drive this more than environmental decision making right now. There's a lot of rhetoric at the federal level as it relates to the Clean Power Plan and whether or not the U.S. will continue to be part of the Paris Accord or not. Here in the state, you know, the governor has always been very supportive of making sure that we have a clean environment, but also a business-friendly environment. So I think we continue to regulate with that in mind. And then that brings me lastly to ozone. You know, at some point we're going to have to get somebody's attention at the federal level with regard to ozone standards, because we here in Colorado and the western states, of course, have other reasons why our ozone levels are high, based on altitude, based on sunlight, based on a couple of other things that give us a higher background ozone that we should try to account for when it comes to establishing whether or what our ozone level should be. So that's a lot. So I'm happy to answer any question right now before I run out. No, I'm just kidding. I'll stick around and turn it over to Kathleen. Thanks again for having me.